Hi, my name is Mike Smolinsky, and I'm the managing editor of Neurology Now magazine. I'm here with Dr. Linda Selwa. She is an expert in epilepsy. In addition to giving the keynote speech at today's Brain Health Fair, she led a class here on epilepsy, giving people, patients and caregivers, updates on epilepsy, on the care and management of epilepsy. Dr. Selwa, thank you very much for being here with us. I was wondering if you could give our iPad audience a little bit of a summary or kind of a quick highlights of the talk that you gave this morning.
Happy to. There were 4 epileptologists in our room, some from here and some from other places. I talked mostly about medical management or medicines in epilepsy. We talked about the fact that there are 20 drugs now, and there were about 15 years ago about 7 drugs. We talked about some of the new drugs coming out of the market, and I like to call them not necessarily side effects, but additional effects. There are both positive and negative effects to most of these medications. It's useful for patients to know which drugs could help them lose weight, which drugs are best for pregnancy, all that sort of thing. We talked also a little bit about primary prevention that we're trying to get to, something a little futuristic in epilepsy, preventing seizures from happening after autoimmune diseases, after head trauma and other things. There are some medications now that may change the expression of genes after a brain insult to make it less likely for people to have seizures. So we give them a little peek in the future about that.
Wow, that's interesting. I imagine that would be something, so many people coming out of veterans of the wars in the Middle East. Head trauma has been, in some ways, the injury of that war. I would think that being able to do some primary prevention would be important.
It's very important. Most people believe that the seizures start right away after a head trauma. That's certainly true with penetrating skull injuries like you might see somewhere in the Middle East, but after more minor head trauma, the average is actually about 8 months to the first seizure. So there are many things that happen in the brain that may be predisposing people to seizures in the way that they react to the trauma. And we may have some opportunity to intervene in that time window.
Thank you very much. It's really interesting, and I would encourage people who are watching, if the Brain Health Fair is in your city, please come. You'll hear talks from experts like Dr. Selwa. All the information is really interesting and really important. Thank you very much.